to do the management of the hypertension of the patient. You need to control the hypertension of the patient. If the patient is taking alcohol, he has to stop alcohol, counseling on stopping alcohol. If the patient is dyslipidemic, you do a lipid, you think that is dyslipidemic, you do a lipid profile, and then you have to, if it comes positive, you have to place him on statins. Is it clear? If the patient has diabetes mellitus, or you place some anti-triglyceride medication. If the patient has diabetes mellitus, how do you confirm? You do a glycated hemoglobin and a fasting blood sugar level. Is it clear? And it's going, if it's elevated and you show that it's diabetes, you need to control the blood sugar level. Sedentary lifestyle and smoking, you need to counsel him on stopping sedentary lifestyle and smoking. Now the next one, for non-modifiable, in cases of patients who are postmenopausal, this one are non-modifiable, so you cannot do anything for these elements here. Now for the novel risk factor, if the patient is HIV positive, you need to tell him to take the antiretroviral and control his viral load. If the patient has left ventricular hypertrophy, something that is already non-modifiable. Chronic inflammation, you have to control the chronic inflammation of the blood vessel. If there is hyperuricemia, you have to reduce the blood uric acid level by giving allopurinol to the patient, and also by giving probenecid. Allopurinol is going to prevent the formation of uric acid, and probenecid is going to result to the release of the uric acid into urine. We have proteinuria. If the patient has proteinuria, you prevent proteinuria by giving ACE inhibitor to the patient. Let's say that the patient has proteinuria and the patient is hypertensive. The best way to reduce that hypertension and proteinuria is by using ACE inhibitor. Is it clear? The next one is anemic. If the patient is anemic, is it clear? You have to always give to supplement the patient with iron, provided the anemia is from iron deficient anemia, or you supplement the patient with blood, provided it is severe anemia. Is it clear? And you have to also find the etiology of the anemia in order to treat it in order for such that it should not have a cardiovascular risk. You have a kidney failure. If the patient has kidney failure and it needs to be controlled, is it clear? But generally, kidney failure is already when you have a kidney failure, it's usually irreversible. Is it clear? So it cannot be much done about that. Now, when the patient has risk factor like oral contraceptive pills, you have to ask him to stop the show, to how to stop it. Is it clear? Postmenopausal cannot be changed. If he has hypercoagulability, you can control the hypercoagulability by giving fibrinolytics. Is it clear? Factor 5 agents. So those are the different things. If you have heart failure, valvular heart disease, ischemic heart disease, and arrhythmia, you need to treat all of them. Is it clear? Respectively by the different management. If you have lacunar stroke, which is caused by a specific antiretroviral, you have to stop that particular antiretroviral in order to prevent the lipohydinosis. Is it clear? And then hemorrhagic stroke, if it is genetic, you can do nothing about that. So those are the different counseling that you have to give to your patient for the management of stroke. Now the next element that you have to visualize now is the follow-up in a patient with stroke.